Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is post implant surgery. Now we'll start with the axial view for better understanding of all the implants together. This is the lower jaw. As you can see, we've got an approximately seven implants in the lower jaw. Now, when you look at it from an occlusal point of view, they seem to be very center of the ridge. The lower anterior implants, however, are placed very lingually in their apex, whereas how all the other implants are placed quite center of the ridge. When we move towards the upper jaw, we have five implants in the upper jaw. All seem to be placed very center of the ridge, whereas the upper left implant, which is in the central incisor region, is close to the incisive foramen. But apart from that, we don't see anything significant to highlight. You can see it right here. We've got a bicuspid incisive canal, and hence the upper left implant is very close to the incisive canal, which is seen right here. Now we're going to take you through each and implant individually. Let's take start from the upper right hand side. The upper right hand side, as you can see right here, quite center of the ridge, a very well placed implant, good bone support on buccal and the lingual. This is the upper anterior implant, as you can see right here. The upper right anterior implant, sorry. We previously mentioned the upper left, but however, this is the upper right implant. My apologies once again. The upper right implant is very close to the incisive foramen and placed palatally, as you can see on this view. The upper left implant is placed at an angle but very good bone support. Buccal and lingual, you can see slight less bone crestally, but otherwise it looks absolutely decent. This is the upper left implant in the molar region, and this is another implant in the upper left molar region. Both shorter in height but good bone support overall. The lower left implant, as you can see, this is the distalmost molar implant. Shorter implant, but well supported by bone. On the buccal aspect, however, lingually we have slight bit of bone there. This is the premolar region implant, tilted but good bone support. Slightly lingual bone support seems to be softer, but good bone support. This is the implant on the lower left anterior region. This is slightly perforating the lingual cortical plate here, something to be kept in mind at the time of restoration. And this is the other anterior implant again. Lingual plate seems to be involved into the implant drilling. This is the implant in the lower right canine region. You can see very clearly, very well supported by bone. There you go. This is the premolar implant, again very well supported by bone, and the lower right molar region implant could be deeper. We've got a slight bit of bone at the bone loss or slight bit of bone. The implant is slightly extended beyond the crest, but other than that, center of the ridge. Thank you very much.